Palpitations are common and heightened awareness of your heart beating. When you become aware that it's beating or it's beating fast or the way it's beating has changed, that can sometimes indicate a problem with the heart. I'm Dr. Joban Sehmi. I'm a consultant cardiologist specialising in advanced cardiac imaging. Palpitations are really common and stressful. So palpitations are a heightened awareness of your heart beating abnormally and present in many ways, and they can be very benign or more serious. Typical descriptions include thumping in the chest, racing of the heart, fluttering of the heart. Think about climbing a long flight of stairs. You climb each step, and if you miss one step or if you trip over one step, you can still carry on walking. Missed step, analogous to a missed beat or a skip beat. It may transiently make you feel a bit unwell. It is very common. If you're anxious, if you're stressed, you'll become more aware of your heart beating faster. And any anxiety-related palpitations are usually not cardiac. Time palpitations are benign, but sometimes they can indicate something a bit more serious. However, if you're aware of your heart beating rapidly, particularly if it comes on abruptly and lasts for several minutes, if not hours, then that may suggest there's something significant there, and that does merit an assessment. So when should you worry about palpitations? Important to be aware of certain red flags. Palpitations that come on abruptly and last for minutes. If there's significant associated symptoms such as chest pain, breathing difficulties, feeling faint, if you lose consciousness, they definitely require an assessment. Look, it's completely normal when you exercise to be aware of your heartbeat, but if your heartbeat is racing with exercise, particularly at low levels of exercise, then this may indicate a significant issue. Any palpitations that are associated with loss of consciousness, particularly if you sustain an injury, for example a broken arm or a head injury, it's very likely that there's a significant underlying cardiac cause. Palpitations that occur in individuals who have a family history of heart disease, particularly heart disease in younger family members, these are also very important, and these are addressed urgently. Duration matters. If the palpitations last a few seconds, they're very distressing. Palpitations that last for several minutes, hours, days, these mandate a closer look. Your heart is working really hard. Every day your heart will generate 100,000 heartbeats, which is completely normal. Symptoms cause distress, but please be reassured, in vast majority of the cases, there's a very simple, benign explanation. The most common is ignoring symptoms, and you should never do that. If your heart rhythm has changed and it's persistent, most often there's going to be a very simple underlying answer, a very benign explanation, but nonetheless it's important that you get checked. The other end of the spectrum, who panic at every change in their heartbeat, even a missed beat or a skip beat that occurs every 2 to 3 months, that raises a lot of anxiety and they would like to get checked. Other common mistakes are patients experience very significant symptoms as a one-off and then wait for them to recur before seeking medical attention. And if there are any red flag symptoms associated with palpitations such as dizziness, lightheadedness, loss of consciousness, don't wait. It's really important that you get checked out. Often there's a benign explanation, but if it's anything very serious, it's important that see a healthcare professional who can assess you properly, take a detailed history, and then arrive at an accurate diagnosis to assure you or to implement the correct treatment. My approach to palpitations is first and foremost taking a very detailed history. I'm interested in when the palpitations started, whether they're abrupt, whether they come on suddenly or gradually, any obvious triggers, any associated symptoms, dizziness, or any red flag symptom. Basic tests such as an ECG, which is a recording of the heart's electrical activity, and that can often give some clues as to the underlying problem. And depending on how frequent your symptoms are, then I would recommend cardiac monitoring, an ultrasound scan called an echocardiogram, and this allows us to look at the heart structure and function. It is very unusual to get very significant palpitations or harmful palpitations if your heart is structurally normal. Palpitations are extremely common. They are also the most misunderstood symptom. In vast majority of the cases, there's often a very simple explanation, often very benign, that often doesn't require any treatment beyond lifestyle changes. It's really important, if you do experience palpitations, to come and get assessed by a health professional who has an expertise in heart rhythm disorders. If there's an important issue, it's important this is diagnosed early so that it can be treated effectively. Even if it's a simple explanation, often finding out and getting clarity of the underlying diagnosis is extremely reassuring, and that in itself is a treatment.